Welcome to this presentation on PCOS. This is a presentation for health professionals specifically. I'm going to be focusing on clinical insights on evidence-based nutritional and herbal supplements for PCOS. And I just want to start by saying that I think this is a very important component of an approach for PCOS as part of a complete approach. So obviously, as a practitioner, when you're putting a protocol together, the other approaches may include looking at diet and nutrition and stress management and physical therapies. I'm an Arvigo practitioner, so that's an abdominal massage technique that I teach my patients. So that may be a therapy that I found useful often for PCOS and gynecological concerns. So I'm just emphasizing that I am aware that this is one component of a complete approach, but I think it's a really important component. And I think there's some really compelling research to show that. And I wanted to emphasize that. I also think we all probably can agree that PCOS could be more studied and more better understood. We're just understanding that there are subtypes and there are many variations of how that can present in your office and in a patient. And so I'm aware that you want to and encourage you to tailor the treatment per the individual. But I, again, really feel excited to focus today on nutritional and herbal supplements that could really make a difference and are important for you to know about as a health professional. So let's get started. All right. So, clinical insights on evidence-based nutritional and herbal supplements for polycystic ovary syndrome, PCOS, with me, Dr. Christine Matheson, naturopathic doctor. Who am I? I am a naturopathic doctor licensed in Ontario, Canada since 2001 with a commitment to women's digestive, pelvic, and gynecological health. I was honored to be one of the first naturopathic doctors in Canada to work in a hospital setting at the former Multidisciplinary Women's Pelvic Health Center at Women's College Hospital in Toronto. And I'm grateful I had that opportunity to work closely in that clinic with gynecologists specifically to provide integrative approaches to many gynecological concerns. One of those was PCOS. So a lot of my experience came from that experience and then through my own private practice. And in addition to private practice, I do create educational health content for a supplement company as well. So, what is polycystic ovarian or ovary syndrome? It is a common endocrine disorder affecting individuals with ovaries. PCOS affects 6 to 12% of people with ovaries of reproductive age in the US and up to 20% of women globally. It's one of the most common causes of infertility, unfortunately, as well. It's characterized by hormonal imbalances, insulin resistance, and metabolic disturbances, which can manifest as irregular menstrual cycles, elevated androgen levels, insulin insensitivity, and ovarian cysts. PCOS can contribute to symptoms such as acne, excessive hair growth, weight gain, and difficulty conceiving. And the condition also increases the risk of developing type 2 diabetes and cardiovascular issues. Key symptoms, and it does vary from patient to patient, but irregular absent menstrual periods, excess facial or body hair called hirsutism, as you know, acne or oily skin, weight gain or difficulty losing weight, thinning hair on the scalp, often called androgenetic alopecia, blood sugar dysregulation. What are the causes and factors that could lead to PCOS? Insulin resistance, as I mentioned, is a hallmark of PCOS that leads to elevated insulin levels, which in turn stimulates the ovaries to produce more androgens, which can worsen symptoms like hirsutism and acne. Hormonal imbalance with high levels of androgens, such as testosterone, interfering with normal ovarian follicular development, leading to irregular ovulation and menstrual cycles. Low-grade chronic inflammation often accompanies PCOS, contributing to insulin resistance and worsening metabolic symptoms. There are some subtypes we're exploring. There are 3 criteria for that: the hyperandrogenism, the oligomenorrhea or amenorrhea, and the polycystic ovaries on ultrasound. And so important to note these subtle distinctions. And I'm going to show you a chart in a second that these criteria fall into to help you understand the subtypes. So there you have the classic type A and type B, and the non-classic type C and type D. And so the criteria falls slightly differently for each of those. So I think as a health professional, this is something that you might want to explore more because there are different subtypes. The treatment strategies may be similar, but it may customize the treatment strategies. So what are the clinical strategies you're focused on? You're wanting to focus on supporting ovarian cellular health, supporting healthy glucose levels and insulin stabilization, supporting optimal metabolism, supporting overall reproductive health and regulating the menstrual cycle, supporting the health and function of endometrial tissue for overall for overall uterine wellness. So making sure the uterus is healthy, all the layers of the tissue, and working on that cellular level, providing anti-inflammatory and antioxidant support. So those are your overarching clinical strategies. The key nutrients and herbs that I want to share with you to consider that are really important and are evidence-based are N-acetylcysteine, inositol, vitamin D3, vitamin C, zinc, chromium, and the herbs, cinnamon extract, berberine, black cohosh, and ashwagandha. So definitely excited to dive into these with you. Before we do, though, I want to say there's a real importance of sourcing high quality supplements. And when you're guiding your patients, you want to obviously make sure they're taking clean and pure products that are filler free, non GMO, CGMP certified lab and suppliers, prioritizing whole food ingredients, ideally meeting or exceeding FDA and Health Canada safety standards. Allergen free often is a real consideration for many patients. Gluten, dairy, nuts, soy, for instance, free of those. And again, really focusing on evidence based supplements. So, clinically researched ingredients with high bioavailability, high extract ratios, and third party tested for purity and potency so that we really going to know that based on exploring the research that the form of the supplement you're giving is going to really deliver. So let's start with NAC. NAC is an antioxidant that protects against oxidative stress, supports ovarian health, enhances insulin receptor activity. By reducing insulin resistance and lowering testosterone levels, NAC helps with symptoms of PCOS, such as hirsutism, acne, and irregular ovulation. So, studies have really shown that NAC improves metabolic parameters, such as fasting blood glucose, total cholesterol, and BMI, enhances reproductive outcomes by increasing the follicle stimulating hormone, FSH, levels, and reducing total testosterone and supporting ovulation and pregnancy rates compared to placebo. So some really compelling studies to explore there as the key supplement to keep in mind, certainly for PCOS. Inositol, as I mentioned, particularly myo-inositol and D-chiroinositol with a specific combination, are key compounds involved in insulin signaling and reproductive hormone regulation. So, a systematic review of 26 trials found that inositol supplementation improved menstrual cycle regularity and showed non inferiority to metformin in reducing testosterone, BMI, and insulin levels. Another study highlighted inositol's ability to restore spontaneous ovulation and improve ovarian response, boosting fertility potential. So, really a real key player. And I think most of you probably are aware of inositol. It's the form of inositol that really does matter, and including that as part of your protocol is going to be a priority. Vitamin D3 plays a critical and crucial role in improving insulin sensitivity and regulating ovarian function in women with PCOS. So, a research meta-analysis of 20 randomized control studies found that vitamin D supplementation significantly increased pregnancy and ovulation rates while reducing androgen levels, luteinizing hormone, follicle stimulating hormone, and early miscarriage rates. So that's really significant to note. And I think we've all become accustomed to see vitamin D being beneficial for other reasons, for bone health, for immunity, but it has a very specific role in many gynecological conditions as well because of these pathways that it impacts as well. So, including vitamin D3, specifically vitamin D3. Vitamin C reduces oxidative stress and inflammation, which are elevated in PCOS, and contributes to insulin resistance and ovarian dysfunction. So the studies show that vitamin C improves antioxidant activity, reducing ovarian cyst formation, lowers inflammatory markers in PCOS rat models. And in women with PCOS, antioxidant supplementation, including vitamin C, significantly improved their oxidative stress markers and increased pregnancy and live birth rates compared to placebo, which again, in your journey with a patient with PCOS, may, the desire to conceive and have a healthy pregnancy, it becomes often a big point, or in some cases is a major concern. So knowing that nutritional supplementation could help improve the chances of that, I think are really worth noting. Zinc. Lower zinc levels are associated with an increased risk of developing PCOS, with studies suggesting that women with PCOS tend to have a lower serum zinc level compared to healthy controls. So, a randomized controlled trial investigated the effects of zinc supplementation in women with PCOS and found that results showed significant improvements in symptoms such as alopecia and hirsutism, as well as a reduction in plasma malondialdehyde, or for short, MDA levels, which indicates lower oxidative stress. So again, a very simple mineral that could, if missing, replenished, could make a really big difference in the health of a woman with PCOS. Chromium and cinnamon. Cinnamon has traditionally been used to support blood sugar regulation, so we are aware of that. And then chromium is a trace mineral that's also well known for its role in improving glucose metabolism. So both are really key and essential to help manage polycystic ovary syndrome due to their positive effects on blood sugar and metabolic parameters. So it's definitely worth considering both of these to really work on that level. Cinnamon supplementation helps lower fasting blood sugar, insulin levels, and insulin resistance, while also improving cholesterol profiles by reducing LDL-C, total cholesterol, and triglycerides, and increasing HDL-C. And then chromium paired with that, or even on its own, supports PCOS management by improving pregnancy rates, reducing acne and hirsutism, and lowering inflammation markers and oxidative stress while enhancing antioxidant capacity. I mean, that is really valuable to know as a health professional, again, that something such as chromium and cinnamon could make an impact and make a difference in this case. Berberine, that's gained a lot of attention in the last little while, is widely used for glucose regulation and has shown promising effects in improving key aspects of PCOS, particularly in addressing insulin resistance, reducing androgen levels, and improving metabolic health. A systematic review of clinical trials found that berberine significantly decreased waist to hip ratio, insulin resistance, and serum androstenedione levels. Another study indicated that berberine had similar effects to metformin in alleviating insulin resistance and improving reproductive endocrine conditions. So very, when we ever compare a herb to medication, I think it's really useful to know, because there are some patients that, for instance, can't take certain medications or experience stronger side effects from them. So to know that this could offer similar or equal benefits to insulin resistance could make a really big difference. And finally, black cohosh, a plant used in traditional medicine, is known for its phytoestrogenic properties and has been studied for its potential to aid ovulation and improve fertility in women with PCOS. So one study found that black cohosh led to favorable hormonal changes, including improved LH-FSH ratios, and increased progesterone levels, suggesting better ovulation. And another systematic review of randomized controlled trials found that black cohosh, when used with clomiphene citrate, improved hormone regulation and endometrial thickness, which are important for fertility. So again, remarkable studies and notable studies to see how this could be integrated for a patient with PCOS and could make a difference in their symptoms of PCOS and also their success in conceiving and having a healthy pregnancy, which is an important concern for many of those with PCOS. Oh, and one more. Ashwagandha is a herb in Ayurvedic medicine traditionally used for its adaptogenic properties to help the body cope with stress and restore balance. It's for women. The study around it for PCOS is that ashwagandha is beneficial due to its ability to regulate cortisol levels, reduce stress, and improve insulin sensitivity. And these effects help address common PCOS symptoms, such as hormonal imbalances, irregular periods, and infertility. Additionally, ashwagandha has shown promise in reducing hyperandrogenism and improving ovarian health, making it a valuable natural remedy for managing PCOS with minimal side effects. So again, just bringing our attention to these range of evidence-based nutrients and herbs to consider: NAC, inositol, vitamin D3, vitamin C, zinc, chromium, and the herbs cinnamon extract, berberine, black cohosh, and ashwagandha root. What form can patients take these nutrients and herbs in, you might be asking? These nutrients and herbs can be taken each individually by purchasing multiple bottles of capsules, which can become costly. Some all-in-one formulas designed for PCOS exist that contain some or all of these evidence-based ingredients in one capsule form, making it much more affordable and convenient. And I definitely find that my patients veer towards, wanting to know what their options are in regards to that. So very important to know that there are these options. Pro tip is always remember to consider formulations that are designed by respected health practitioners with experience in the area, and supplement brands that prioritize that third-party testing for purity and potency of ingredients, just to underline that once again. So there's high bioavailability and high extract ratios so that that, based on knowing the research, that you're also providing a form of the nutrient or herb that is going to more likely have an impact and be worthwhile. Effectively supporting PCOS patients, it's unfortunately not unusual for it to take an extended amount of time for women to be diagnosed with PCOS after struggling with symptoms for quite a long time, which is frustrating. And proper diagnosis is critical by having awareness of the 4 different subtypes. I do believe that well-informed health professionals can serve a timely and critical need by offering evidence-based and comprehensive support to patients with PCOS. So please be sure to consider these clinically studied nutrients and herbs for PCOS as one of the key components of a more complete clinical approach you may be planning in combination with other valuable interventions such as dietary support, nervous system regulation techniques, and physical therapies. So I hope you found this helpful. Thank you for watching. I really believe that as health professionals, the more knowledge you have, the more you can educate and empower and support your patients to live well and to reach their health goals. Thank you so much. This is Dr. Christine Matheson, naturopathic doctor, signing off. Thank you so much for watching.